Welcome to this video about posterior uveitis, a serious eye condition affecting the back of the eye. In this video, we'll explore what posterior uveitis is, its causes, how it impacts your vision, and the available treatments to help manage this condition. Posterior uveitis, at its core, is inflammation of the uvea, specifically the choroid, retina, and/or optic nerve. This inflammation can stem from a variety of causes. Infections are a common culprit, including those caused by viruses like herpes simplex or zoster, bacteria like tuberculosis or syphilis, and fungi like histoplasmosis or toxoplasmosis. Autoimmune disorders where the body's immune system mistakenly attacks its own tissues, such as sarcoidosis, Behçet's disease, and rheumatoid arthritis, can also trigger posterior uveitis. In some instances, the cause remains unknown. These cases are classified as idiopathic. The pathophysiology of posterior uveitis involves a cascade of inflammatory events. The inflammation causes damage to the delicate tissues of the retina, choroid, and optic nerve. Immune cells infiltrate these structures, releasing inflammatory mediators that disrupt the normal function of these tissues. This leads to swelling, fluid leakage, and potential damage to photoreceptor cells in the retina responsible for vision. The inflammation can also affect blood vessels, leading to vascular occlusion and ischemia. This all contributes to the visual disturbances and other symptoms associated with posterior uveitis. Posterior uveitis is relatively uncommon, with the overall prevalence of uveitis estimated to be around 50 to 70 cases per 100,000 people. However, posterior uveitis accounts for a significant portion of uveitis cases. It can affect individuals of all ages and ethnicities, but certain populations may be at higher risk depending on the underlying cause. For example, individuals with autoimmune disorders or those living in areas where certain infections are prevalent may be more susceptible. The signs and symptoms of posterior uveitis can vary depending on the severity and location of the inflammation. Common symptoms include blurred vision or decreased visual acuity, floaters, those annoying dark specks or strands that drift across your field of vision, eye pain, although this is usually less prominent than in anterior uveitis, sensitivity to light or photophobia, and redness of the eye, though often less pronounced than in anterior uveitis. Some individuals may also experience metamorphopsia, a distortion of vision where straight lines appear wavy. Diagnosing posterior uveitis involves a comprehensive eye examination by an ophthalmologist. This typically includes a dilated eye exam to allow the doctor to visualize the retina, optic nerve, and other structures at the back of the eye. Diagnostic tests may include visual acuity testing to measure sharpness of vision, tonometry to measure intraocular pressure, fundus photography to document the appearance of the retina, fluorescein angiography to evaluate blood vessel health in the retina, optical coherence tomography (OCT) to obtain detailed images of retinal layers, and blood tests to identify underlying infections or autoimmune disorders. Posterior uveitis can be broadly categorized by the affected anatomical location. This includes retinitis when the primary inflammation affects the retina, choroiditis when the choroid is primarily affected, and retinochoroiditis when both the retina and choroid are involved. Vasculitis can also be a component, where blood vessels within the eye are inflamed. The specific type of posterior uveitis helps guide treatment decisions. The primary goal of treatment for posterior uveitis is to reduce inflammation and prevent further damage to the eye. Corticosteroids are often the first-line treatment, administered as eye drops, oral medications, or injections around the eye. Immunosuppressant medications may be necessary for more severe or chronic cases, especially those related to autoimmune disorders. These medications help to suppress the immune system and reduce inflammation. In cases of infectious uveitis, specific antiviral, antibacterial, or antifungal medications are used to target the underlying infection. Managing any underlying systemic conditions, such as autoimmune disorders, is also essential. Regular follow-up appointments with an ophthalmologist are crucial to monitor the effectiveness of treatment and adjust it as needed. While not always possible, some preventative measures can reduce the risk of developing posterior uveitis. If you have an autoimmune disorder, it's essential to manage it effectively with the guidance of your physician. Prompt treatment of eye infections can also help prevent them from spreading to the back of the eye. Protecting your eyes from injury with appropriate eyewear during sports or other activities can also help prevent uveitis. The prognosis for posterior uveitis varies depending on the severity and underlying cause. With prompt diagnosis and appropriate treatment, many individuals can achieve good visual outcomes. However, chronic or recurrent inflammation can lead to complications such as glaucoma, cataracts, macular edema, and vision loss. Recent research is focusing on developing more targeted therapies that can selectively suppress inflammation without causing widespread side effects. Gene therapy and other novel approaches are also being explored as potential future treatments. Regular monitoring and adherence to prescribed treatment plans are critical for maintaining good vision and preventing long-term complications from posterior uveitis.